Hey there, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts. I'm a teacher, I'm an author, and I'm a surgeon. Thank you so much for tuning in. We've just reached over 23 million views on our YouTube videos, and I love educating, and I love talking to people all around the world, which I do every day. Today's topic is going to be temporal implants. And this is something that is a very infrequently performed procedure, but is a very powerful procedure. So facial implants, chin implants, cheek implants have always been a huge part of my practice, and I've done hundreds and hundreds and hundreds of these over 3 decades. And the temporal implant is a relatively new thing. So I want to talk a little bit about this. Now, one of the things, when patients come in for rejuvenation, there's surgical, there's non-surgical, and when people come in with temporal hollowing, which can be something that they're born with, but more frequently happens in older age, the choices are somewhat limited. So probably the most popular choice now is filler injection. And you can inject fillers in that little hollow area and plump out the temple, because that's one of the, it's like the veins in your hand. When you get older, you just have this temporal hollowing. The problem is that's a very dangerous place, and I've done it many, many times, but it can be a dangerous place to inject because the middle temporal artery, and there's documented cases, I believe, of blindness or stroke or other problems from injecting in this area, and there's a lot of literature on that. You could also inject fat, but if you get that in a vessel, that's even a worse situation because you can't reverse it. So what other alternative do you have? Well, one of them is temporal implants. And I use Implant Tech implants. I'm not getting paid for any of this. It's just the brand that I use. And they started out with this temporal implant. And it was made to fill that hollow. And I did a number of cases with this, but I really never thought it was the right implant for the job unless people just had a very small pocket of hollowing. And then they came out with this implant, and I'm not sure if my friend Barry Epley designed this implant or who did, but it's an extended temporal implant. So it's the Implant Tech Extended Temporal Implant. It comes in 2 thicknesses, 4 millimeters and 6 millimeters, and it spans the entire, temporalis fossa here, really from the cranium down to below the zygoma. And it has these little arcs in there to help you if you want to contour this or cut this, which I do frequently. And we're going to show you a very detailed video of placing 2 of these in a second. But really, I don't use the original temporal implant anymore. I think this is much better. Now, whereas chin implants and cheek implants are pretty dense silicone, this is really gummy. These implants, they're very mobile and have the type of silicone that is very malleable and will conform to the area that you're putting them in. And it's very simple to place these. You make an incision in the hairline. You have to go through the superficial layer of the deep temporal fascia, which we'll just call the temporal fascia for now. You have to make an incision in there so you're under the fascia but above the muscle. And I'll show you all this in a second. When you place this, you can do the whole thing easy in 15 minutes. You can do it under local anesthesia, although really virtually all my surgeries are done with general anesthesia in my in-office accredited surgery center. So this is an option that I think will become more popular because I think this is a much more versatile implant configuration. So sit back, we're going to look at some videos. I'm Dr. Joe Niamtu, LoveThatFace.com. We'll begin the procedure by injecting 2% xylocaine, 100,000 epinephrine over the incision site and then over the dissection site. We want to do this in all planes, muscular, subfascial, subcutaneous. This is an implant sizer, so you can get an idea of how big the actual implant is, and they come in 4 or 6 millimeters for male or female. And now we're just going through the superficial fascia down to the superficial layer, the deep temporal fascia. We'll just call that the temporal fascia from here on out. That's the white glistening layer. And we gently dissect through the superficial fascia because the frontal branch of the facial nerve is in that layer. Now we're incising through the superficial layer, the deep temporal fascia, and there's the temporalis muscle. Now we're going to be subfascial, and we're going to dissect all the way to the orbital rim and superior and inferior on the temporal hollow, commensurate with the size of the implant and the size of the defect. And we'll take our little finger, and you can dissect with that too. So this is putting in one of the try-in implants, and this is too big, so we're going to have to trim the final implant, which you'll see in a second. But you could put in a try-in implant. And here is the final implant, and we're trimming it. This is a real gummy, rubbery silicone, very easy to trim, very pliable, and fitting it into the subfascial plane over the temporalis muscle. And you have to kind of put it in crooked so the bottom part of the implant extends first. And you have to make sure nothing is folded over. That's very important. So you want this implant to be mobile, but you don't want a real big pocket. You want the implant as close to the size of the pocket as you can. And I'm just doing some more dissection here to. Now we're going to place the suture through the implant, through the temporalis muscle, and back through the implant like we did previously. This is the 2-0 vicryl suture. Just to firmly anchor this, some people put in several sutures, and some people don't put any sutures in, but I like to secure it. And at this point, we're going to go ahead and close our fascial layer. Again, you can get primary closure on these thinner implants. On the thicker ones, you might not be able to do that, and if that's the situation where you can't get primary closure, it's not a problem because that's pretty thick skin that will cover this. But here we are, once again, closing the temporalis fascia with 2-0 vicryl suture. And we'll try and get as many sutures in there to close everything primarily as we can. And I leave the tails long so we can tuck them in so they don't protrude through the wound. But they will then irrigate the area with clindamycin solution and put 4-0 gut subcutaneous sutures in to approximate the wound edges. Usually put several of these in and then close the skin incision with 4-0 gut suture, and that's pretty straightforward. On the contralateral side, we're going through the temporalis fascia. You can see the beefy red temporalis muscle. We want to be below the fascia and above the muscle and complete our dissection as we did previously. So you can see we're almost to the orbital rim there. There's actually a cutout in the implant to relieve the orbital rim. And we're just dissecting everything. You can use an instrument, you can use your scissors. And then after you get everything freed up adequately, you can put your little finger in there and continue the dissection with your finger. It's just important to make sure there's no adhesions and everything is freed up. And again, you don't want the pocket that much bigger than the implant. So I'm also trimming as we did on the previous side. These are so easy to trim. There's where the implant's going to sit. These particular implants are from Implant Tech, and you can find more information at implanttech.com. On the left is the first generation, the temporal shell implant. I placed a number of these, and they are okay if a patient has a smaller vertical temporal deficit. I now prefer the temporal shell extended implant shown on the right. I think that's a little bit more versatile. It's not quite as thick as the temporal shell, but it can be trimmed, and I find that most people have a little larger vertical component, and this implant works real well. Thank you for your time. I'm Dr. Joe Nyamtu, lovethatface.com.